So today I'm going to be showing you the basics of procedure code, how to find it. We're going to be using our 2019 edition books, our CPT and our ICD-10, and we're also going to be using Bucks Internship 2019. Okay, so the scenario is the patient came in for an x-ray shoulder, single view, clinical symptoms, shoulder pain, clinical history is followed, left shoulder pain, the joint is generally intact, there is a slight increased bone density off the greater tuberosity of the humerus, most likely in the active, a very minimal degenerative change, AC joint is also intact. I do not feel there's significant degenerative change. Conclusion, perhaps minimal degenerative change of the greater tuberosity of the humerus. Acute fracture of dislocation of the shoulder is not seen. So to start off, we gotta find like words that lead us to a possible diagnosis or a possible procedure code. So in this case, it tells us that they did an x-ray on the shoulder. So for our procedure code, we're going to go to our CPT book, and I'm going to go all the way to the back of the book, and you're going to find x-ray, and you're going to go to shoulder, and it's going to take you to 73020 to 73030, and our actual code is going to be 7302 because it's one view, and it's going to be with the modifier LT because they did it on the left shoulder. And that's it for this one with the modifier of the 26 because only professional component was provided. So then we're gonna go to our diagnosis code. We're gonna look at the text, and it's telling us what is basically, we gotta see why the patient is being admitted, and it says that it was because the pain in the shoulder joint. So you're gonna go to the back of the book, and you're gonna go to, let's try pain first. Pain, and then let's try joint. Yes, pain, joint, and shoulder, and you're gonna go to M2551. And then it was our left shoulder, so it's gonna be M25.512, and those are the basics of finding a code in a scenario. So basically, when you're trying to find an ICD-10 code, you want to ask yourself, why is the patient being admitted? Like, what's wrong with the patient? And then that's how you're gonna know what is your diagnosis code. And then for the CTP code, you want to ask yourself, what is being done to the patient? So like in this case, what was being done to the patient? They did an x-ray on the shoulder. Why? Which that's when the diagnosis comes in, and it's because they had pain, and obviously they wanted to see what was wrong with it, so that's why they did the x-ray. And that's how you find a code.